We can start. And I'm really excited today for the APA Lifestyle Psychiatry Caucus webinar, a monthly webinar. I'm Gia Merlot, and we have a very, very special guest today. It's Dr. Beth Frates, who is our immediate past president of the American College of Lifestyle Medicine. She's a trained physiatrist and health and wellness coach with expertise in lifestyle medicine. She has received so many awards, so many honorariums that it's going to be hard for me to actually consolidate them, but she is an associate professor at Harvard Medical School. She's one of the first fellows of the American College of Lifestyle Medicine. She created the first lifestyle medicine interest group at Harvard Medical School. She's been teaching lifestyle medicine at the Harvard Extension School for like 10 years, I believe. And she was one of the first 4 item writers for the American Board of Lifestyle Medicine. She has written numerous books, including the #1 book that most people use for lifestyle medicine, which is called the Lifestyle Medicine Handbook. I don't even know if it has anything else on it, but that's what we call it, the Lifestyle Medicine Handbook. She is our immediate past president of the Lifestyle Medicine group. And she's going to talk today about education because she has not only developed curriculum, she's taught all of us on how to develop curriculum. So with no other further ado, Beth, please. Thank you so much for being here.
Well, Dr. Gia Merlot, thank you so much for inviting me. And thank you so much for all the work that you have done with me and with the American College of Lifestyle Medicine, now with the APA and this group. It is a blessing to be here. I feel honored to be able to share some of my story, my materials. I really do hope that it's helpful for all of you. I am going to try to also look at the chat because it is a small group, and I would love to, I'm just seeing how I can do that. I usually don't monitor the chat at all, but I'm wondering if I can put it on the side where I
I
can.
can monitor it for you and let you
Oh,
know.
okay. Because I just want to, if it's all right with you guys, occasionally ask a question. And if someone could let me know that you're still there. Although I love this group, and this is certainly people in the field of psychiatry because you have your cameras on. I know that many of you have been to meetings where there's people and it's just black boxes. So, mind you, I also know that you may need to go somewhere and turn your camera off, and please feel free to do that. But just seeing your faces during the introduction was really warm. So, thank you for that. That's our social connection pillar. You guys do that in spades. So, thank you. I am going to spend some time talking about the landscape of lifestyle medicine in medical education, the past, the present, and hopefully we'll even have ideas for the future. You guys are creating the future with lifestyle psychiatry and your curriculum and your education in lifestyle psychiatry. Maybe after hearing this, you'll have some new ideas that are sparked. I hope so. We're going to get to the beginning, to the root, and we're going to get to root causes. And that's what lifestyle medicine does, as you well know. This really seminal study, landmark study for us in lifestyle medicine by Mockdad and colleagues. And if you were at the American College of Lifestyle Medicine in our 20th celebration this past October in Orlando, then you know that Dr. Mockdad did receive the research award. He is the first recipient of a research award from the American College of Lifestyle Medicine, rightly so, as you'll see here. In the year 2000, people were talking about what's causing deaths in the US. Of course, it's heart disease, cancer, stroke. But what Mockdad did so well and published in JAMA was that he said, well, those are the diseases, but what's causing those diseases? That was the question. And as you know, I'm sure many of you are familiar with this seminal study. Tobacco was #1. They did lump poor diet and physical inactivity together. That's interesting. But then comes the two of them together. Alcohol consumption, as you can see, microbial agents, and the list goes on. I had a prediction, and I'm sure you all did too, being in psychiatry field, that sleep was going to get on there. And as you know, the American Heart Association did put sleep into the essential 8 in 2022 in the spring. I'm going to say it out loud here, and I know you've all made this prediction as well. Stress. That's going to get in there too very soon. So at any rate, here, this was published in 2004 in JAMA. That's an interesting and an important year to remember. And in the history of ACLM, why? That's when we were founded. American College of Lifestyle Medicine was, in fact, founded in 2004. There was enough evidence, enough research, enough physicians and healthcare professionals, enough interest in this area to begin the college. Now, Mock Dad wasn't finished with his work. He actually published another important and seminal paper that updated burden of disease, injuries, risk factors among the United States, looking at the number of deaths and percentage of disability adjusted life years related to our 17 leading risk factors in the United States. So, what at this time in this publication was leading the way? Well, I know you probably guessed this if you didn't already read this article, which you likely will, but dietary risk factors were more of a cause of disability and death than tobacco use. You have high systolic blood pressure, then high body mass index, high fasting plasma glucose, high total cholesterol, and the list goes on. Low physical activity is actually down here on this current list, dietary risk factors being none. This is a major pillar in lifestyle medicine when you're studying for the boards, and I know many of you have and are already board certified in lifestyle medicine from the American Board of Lifestyle Medicine. Nutrition is a large focus of our curriculum, of the boards, and what physicians who practice lifestyle medicine need to be competent at in order to help people adopt, sustain healthy lifestyles. So a healthy eating pattern, and be able to help them understand where they are now with their diet and where they need to be to prevent, treat, and in some cases, reverse a diagnosis like diabetes or high blood pressure through diet and lifestyle. So let's just look at our updated definition. This will get updated again. A latest update is from 2022, and we do updates routinely. Lifestyle medicine is a medical specialty. So if you look at the AAMC, American Association of Medical Colleges, as of last year, medical students, when they're looking through to find specialties, they can see lifestyle medicine as a specialty as of last year. So anyway, it is a medical specialty that uses therapeutic lifestyle intervention as a primary modality to treat chronic conditions, including but not limited to cardiovascular disease, type 2 diabetes, and obesity. Lifestyle medicine certified clinicians, Gia did mention that we do have a certification exam as of 2017. I know this because, yes, I was one of the 4-item writers to create that exam, and what a thrill that was, to be honest. A big honor, and also probably one of the most fun things I've done yet with my career. But at any rate, lifestyle medicine certified clinicians are trained to apply evidence-based whole person. That's an important word, especially for you. You know this better than any specialty. Whole person. And then another important word, prescriptive. Lifestyle change, prescriptive. There are doses to this. So we can prescribe nutrition at different doses, frequency, intensity, duration, exercise at different doses, stress resiliency at different doses. And often you can see, let's just call it medications compared to lifestyle, and they'll just call it lifestyle intervention without actually going through the specifics. Did they look at nutrition, sleep, stress resiliency, exercise, risky substances? What did the lifestyle medicine intervention entail? How many of the pillars is the question you all need to ask. Also, what was the intensity of the intervention? Looking at the dose of nutrition therapy that was given, exercise therapy that was given. Okay. To treat and when used intensively, often reverse such conditions. The diagnosis of that being hemoglobin A1C is definitional, and how we make the diagnosis for diabetes, if we can change that, pull that hemoglobin A1C down so that a person no longer has the criteria for the diagnosis of diabetes. This is power. And we do have clinical practice guidelines for diabetes coming out in 2025 that are lifestyle related. Then lastly, in our definition, we spell out our 6 pillars. Applying the 6 pillars of lifestyle medicine: whole food, plant predominant eating pattern, physical activity, restorative sleep, stress management, avoidance of risky substances, and the use of positive social connections. Also provides effective prevention for these conditions. We talked about prevention, treatment, and then reversal of these diagnoses. This is a graphic. Some people are visual and they can really remember a picture that they see, and others are really story oriented and they can remember lifestyle medicine through clinical cases. So this is where, Gia, I would ask you, because I'm just wondering if anyone in the room, how many people in the room can clearly identify this gentleman? If you know exactly who this gentleman is, could you say yes in the chat? And Gia, could you just list just give me the number of yeses out of the number of participants we have today? How many people? I know Vise knows this. I know Gia knows this. So how many people know who exactly who this gentleman is?
So just type yes or no on the chat. Yeah, so most people are saying no.
No. Okay. Yeah. Okay. So he's not famous, but he is very.
Oh, Roy Fan knows who this is. Roy.
Okay, Roy, 1, and I know
Mhm.
you and Dr. Beast, so that's 3. All
Okay,
right. So that means it's a minority, clearly, right? All
right.
right.
Everyone else is
So,
saying no. Mhm.
okay, thank you. So yes, he's not famous, but he is a common man. So I'm going to spend a minute telling you a story that will really help, I hope, solidify lifestyle medicine for you. Here, this gentleman is healthy and he's 72, but I need to take you back to a time when he was 52. So 20 years before this picture was taken. By the way, I know you're a psychiatrist. He has given me full rights to share every aspect of his story with anyone that will listen, in hopes that his story may help change someone else's life. So that's a 52-year-old New York City businessman, overworked, overstressed, overweight, who walked fast, talked fast, ate fast, mostly all at the same time, all 3 at the same time on the streets of New York. Sleep was minimal, 2 hours perhaps at a time, going to bed at midnight, waking up around 2, getting a little snack, ice cream, Oreos, Cheetos, crackers, chips, whatever was there, go back to bed for a little bit, then wake up needing to write a to-do list down, maybe have another snack, and then surely be up by 5 to catch the 6 a.m. train into New York City. Be the first at work, first in the office, 101 Park Avenue. His dad started the company. He and his brothers took it over for the second generation, and his goal in life was to make that successful. His social connections, he was married, had kids, but his clients, his colleagues, this is who he was interacting with every day. In fact, when he was home, he wasn't home. And I know you're psychiatrists and involved in the field, so you know what I mean. He was always thinking about work, even when he was home. Now let's do risky substances. It's the pillar he had down. He did not smoke ever, and he did not drink. I think he drank in high school and college. At any rate, he hadn't had a drink since 21. So I told you about pretty much all the pillars, except, is anyone listening? I did miss one. I did miss one pillar. Told you nutrition. Told you sleep. I told you stress. I told you social connection. I told you risky substances. There's one other pillar I didn't mention.
Yeah, exercise.
Yes, exercise.
Thank you,
Now,
Pam.
now this gentleman was fit and actually a really quite a good athlete in high school. Soccer, basketball, baseball, third base, really active. At any rate, at this 52-year mark in his life, sedentary, no exercise. Not entirely true. He did one thing. I wonder if anyone can guess what he did. Gia, let me know if we have any guesses. This New York City businessman, one thing that he did for movement, for physical activity. Any guesses?
Walking.
That's a good guess, and that would probably have helped him, actually.
Walking from MTA to office. Pickleball.
That
Oh,
would have been. I love the idea of this guy playing pickleball, by the way. Just knowing him, I love.
Weightlifting. We have a weightlifting guest.
Ooh, that would be again, these walking, pickleball, weightlifting, great idea.
Stairs. Stairs.
Also, still would be a good idea. He had an elevator at work, so no, no.
Be lifting up his children.
Yeah, and that may have happened when they were younger.
Equinox. Somebody says equinox. Thank you, Mila. Yeah, I love your.
Nope, not that either. I think you need a clue. It happened at the very same time of the day, but you didn't know what day it would happen. It could happen any of the 7 days of the week, but it was definitely at the same time. Definitely the same time to the minute. Same time to the minute. Does that help?
Nobody has a
You
guess.
need the time. You need the time. The time will give it away. 11:07 p.m. Does that help?
11:07 p.m. He turned
PM.
off the TV.
Turned off the TV. Very, very good guess.
Somebody guessed sex.
Okay. That's a medical student. Whenever I give this story, the medical student always says it. So whoever said, I'm sure they're a medical student or young at heart, obviously. That I cannot attest to. I do. That is a part of the history I am unfamiliar with. At any rate, okay, these are all great guesses, but it is sprinting, mad dashes, actually, as fast as the man could run. 11:07 from the whatever, I think it was the 20th floor in 101 Park Avenue, elevator down, sprint to Grand Central Station to catch
Yeah.
the last train home. If he
Or
didn't
somebody for Subway. Yep.
subway, if he didn't catch the train home, he slept in the cot that he had at work. And sometimes he did. He did sleep in the cot. So he ran to catch that train. One of these train rides, little pressure, no pain, no gain. He forges forward. He's a New Yorker. Come on, got to make the train. Gets on the train. You know the story. Numbness and tingling down the left arm, short of breath, diaphoretic. Gets to the home stop. His wife, who's a teacher, picks him up, sends him right to the local emergency room where he completes his massive myocardial infarction and middle cerebral artery stroke, leaving him paralyzed on the left side. That's the day in the life of a 52-year-old man that has a lifestyle and had a lifestyle for several years, like the one I just shared with you. Fortunately, it was 86 and he was a New Yorker and he was savvy and he learned about Pritikin centers. So he and his wife spent time at Pritikin centers. And you may not know about Pritikin, but these are one of the first lifestyle medicine centers. It wasn't called that in the 80s, where people who had cardiac disease could recuperate, learn about nutrition, especially, and also safe exercising, stress reduction. This gentleman did participate in that. It was an inpatient type of scenario. He and his wife spent time in Florida at the Pritikin Centers. By the way, Nathan Pritikin did receive the Lifetime Achievement Award at the American College of Lifestyle Medicine this year. So the good news is he made a full recovery and a full lifestyle change, exercising routinely 150 minutes each week, eating whole food, plant predominant eating pattern, and stress relieving with walks, with talking, no more yelling, able to socially connect with his family, actually kissed his wife for the first time in front of his children after this stroke. And I know the story so well, including that kiss, because does anyone know why I know his story so well? Any guesses? Not the people who really know, like Roy, but anybody who is guessing why I know this story so well, like the cot in his room, in his
Put it in the chat, guys. It's your father. There we go.
yeah. Yep. That's dear old dad. That was 1986. I moved from economics to biology major at Harvard because of this. And I was fascinated with his recovery. And he maintained this lifestyle and lived his best 27 years after that health setback. So I said, why don't we get people to do these changes before they have this heart attack and this stroke? And that's why I'm here today, and I will talk at any time of the day or night, anywhere that anyone asks me to talk. So thank you, Gia, for this opportunity. But here's Pritikin. We know that he was one of our very first pioneers in this, and his cardiac rehab is reimbursed. Ornish's is reimbursed, and Benson Henry is reimbursed. These are important opportunities for those that have had heart attacks and strokes to get the care they need so that they can adopt and sustain these healthy lifestyles. He had evidence and research back from 1983 that really showed significant reduction in the total cholesterol levels, blood pressure, and the BMI, and many of the same markers we're looking at today in 2024. Shortly after that, I knew that diet was really important, and so was exercise. Had done a lot of that reading, and Pritikin did that work. And then this article came up, and I read it at Countway Library myself. When you actually, that's how you got your news, right? Going to library. And I read this article by Rosansky and colleagues about mental stress and how mental stress can create silent myocardial ischemia. I knew this man was stressed. I was positive. I saw it with my own two eyes, and I said, this has to be part of it. Well, lots of people thought the same thing. You all know your masters of stress management, stress resiliency. And sure enough, this is the EKG looking at the patients that were in this study when they underwent exercise and then when they underwent mental stress. And they did serial sevens for the arithmetic and the math, by the way. And you can see when the ischemic response occurred in the patients. I actually replicated this for my senior thesis at Harvard with Andy Littman, a psychiatrist you may know. He was at Mass General Hospital, and he ran the cardiac rehab at Mass General Hospital while I was there as an undergraduate. Now, then I went into physiatry to help stroke survivors, hoping that they would not feel defeated and they would understand that they could, in fact, lead their best lives after a stroke. Not all of them recover fully, as you well know, but you can have a full life. And this was one of my missions. So while I was a resident in physical medicine and rehabilitation, you know that we are interested in exercise and how exercise can impact recovery. Well, many of us in 2000 were also athletic, and we ourselves were doing exercise, and we were sitting around the residence room. I remember it so well. And we said, do you think it matters if physicians exercise? Do you think those people, those physicians counsel on exercise? We were all thinking, I don't know. I'm not sure. Well, we did the study. We did a survey study, and we looked at primary care physicians. We asked them, do you exercise? Do you counsel on exercise? We asked them, do you counsel on aerobic training? Do you counsel on strength training? Then we said, do you do aerobic training? Do you do strength training? Sure enough, what did we learn? We learned that physicians who exercise counsel on it. Specifically, if physicians don't do strength training, they don't counsel on it. If they do strength training, they counsel on it. Same for aerobic training. Fascinating. So then and there, I realized we need to get physicians on board with lifestyle medicine for themselves as well as for their patients. And if we get them going, then we'll be able to have an impact on thousands of people, their patients. Now, during this study, I thought you would find this fascinating. We asked, what are your reasons for counseling on exercise to those of you that do counsel on exercise? And please do notice cardiovascular disease prevention, of course, is high for aerobic exercise and some for strength training. Please look, psychological benefits, it's there. They knew about it. People have known that there's a connection between your lifestyle and your mental health, especially exercise, for a long time. I just like to see what else they were commenting on back in the 90s. This was published in 2000. We did the study in 98, got the results 99, and then published in 2000. But it's interesting to see. And these are the actual results that I already shared with you. Another really interesting fact that propelled me into this education field was the fact I wondered if stroke survivors knew what happened to them by the end of their 4-week, mind you, this was a 4-week stay early in 2000, right? And when I was a resident, I wondered, do they know if they had an infarct or a hemorrhage? This is important information, as you well know. Well, unfortunately, in this study, we found that only 46% of participants actually knew if they had a bleed or a clot. So they were not getting the information, even in the 4 weeks when we were counseling them on prevention. Then I wondered, well, how about the family members? So we got together and we looked at the family members. Said, well, are the family members able to tell us if the patient had the stroke by clot or bleed? Well, at least 60% of them could. These numbers were not enough. It was begging for more information, more education. So my first foray into this, and I know many of you have done this, is to write a book for the public. So, Life After Stroke with my chair of stroke at Spalding, Joel Stein, Julie Silver, a mentor of mine who had written several books with Johns Hopkins Press and had an in, and we got a contract with Johns Hopkins Press. And this is recovering your health and preventing another stroke. So, for the lay people, not in medical school, not in residency, did I learn all the details of exercise, nutrition, and stress management on my own for this book. Well, Eddie Phillips, he was an attending and a friend of mine when I was a resident. Later now, 2006, I graduated in 2000, 2006. I'm at an event, as we all go to our departmental meetings. Christmas is coming. We're having some here. Holidays are blazing here. Lots of different celebrations happening. And sure enough, at our party, he said, you know, your book, you're doing lifestyle medicine in 2006. Remember, American College of Lifestyle Medicine was born in 2004. 2006, he says, you're doing lifestyle medicine. That sounds like me. What is that? He said, well, it's using everything in your book for not just stroke survivors, for everyone. Sign me up, I said. So we started the Institute of Lifestyle Medicine at Harvard and started giving CMEs. That year, shortly after 2007, 2008, we were giving CME courses. That was our first foray. I went from teaching the patients to teaching the faculty to teaching the CME courses on lifestyle medicine with a focus on exercise, nutrition, stress resiliency. And then I got some extra training in motivational interviewing and health coaching, and I would teach the behavior change pieces of these CMEs. Then I got into the American College of Lifestyle Medicine, fortunately. So here's the history. 2004, we are created. 2006 is where I started. 2008, we started the first lifestyle medicine interest group that Gia mentioned. 2010, a very important JAMA article putting out what? The core competencies for lifestyle medicine. Then 2012, did you know there was the AMA resolution? They adopted a resolution that called for all physicians to acquire and apply the 15 clinical competencies of lifestyle medicine spelled out in that JAMA article in 2010 to as primary modality for preventing and, when appropriate, treating chronic conditions within clinical medicine. They actually call this out as a resolution in 2012. Well, 2015, ABLM is born. You know that 2017, we have the first exam. 2018, the first fellowship is how it gets created. I hear you guys are starting with the lifestyle psychiatry residency. And then we also started a residency, as you know, and then maintenance of certification was introduced. Well, then it went like wildfire, which likely lifestyle psychiatry is going to explode like this worldwide as well. And we have so many professionals, practitioners, physicians that are board certified in lifestyle medicine now. Physicians are board certified through ABLM, and then other healthcare providers are certified through ACLM. I know that you also work in a team approach in psychiatry like we do in physiatry and in lifestyle medicine. So we want the whole team to get educated and certified. Then we had updated core competencies 2022. So look at that 10 years later. We had the White House conference on hunger, health, and nutrition, which led to a nutrition summit for educators. So I went to that summit. Several other presidents of medical specialties, as well as program directors of residencies and chairs of departments, attended this summit. And what came out of that summit is a JAMA article on nutrition competencies for medical students, which I'll share with you shortly. It came out in September. Fortunately, we applied for AMA to be in the House of Delegates as a specialty of lifestyle medicine, the American College of Lifestyle Medicine. We were accepted this past June. We then had our partnership with Blue Zones to bring this out to the community. And here's another educational endeavor, which is to create a board certification for physicians who are already certified in lifestyle medicine. Now they'll be certified in Blue Zones, a Blue Zone certified physician who can apply lifestyle medicine to the community. So that's important. We have a journal, American Journal of Lifestyle Medicine. Many of you have published in that, I know, and many of you are involved in the editorial team, as Dr. Gia Merlot and I are part of that. Having the academic textbooks, which you have with lifestyle psychiatry as well. We have a massive textbook. I know you're familiar with it, Dr. James Rippey's book. It's in the 4th edition right now, which is incredible. And then here's the Lifestyle Medicine Handbook that Dr. Gia Merlot was kind enough to mention, which was published in 2018 and then updated in 2020. And we'll do another update this year. I just want you to know I'm bringing this up. All my proceeds go to ACLM. If you happen to buy the book, it's not going to impact my pocket, fortunately. I do have another resource for you that Gia helped. As I mentioned, Dr. Gia Merlot, it's been really valuable to the entire of lifestyle medicine. And she helped with the Lifestyle Medicine 101 curriculum, which is the curriculum that I taught in 2014. Dr. Merlot mentioned the Harvard Extension School full semester course for bachelor's and master's degree. Interestingly, listen to this. The master's at Harvard Extension School is in psychology. So this LM 101 curriculum helps bachelor students in their concentration of psychology. That's where these lifestyle medicine courses sit. LM 101 was introduced in psychology and the master's towards psychology. It's got 13 modules. You can use this now, as Gia well knows. She helped us adapt it for public use and to be put forward by any faculty that wants to utilize it, so that we could have images that were copyrighted correctly and got all our ducks in a row for this, so that we could freely push it out. And it has been downloaded by 400 faculty. These have been, interestingly, program directors and chairs of divisions that got the PPDs, and 1,800 have accessed the PDFs from 25 different countries. So this is really an international movement. I'm just giving you a short example of what you could find in the about 150 to 200 slides per module. You can see the modules on the left. And a very important part of all this is the empowering people to change, collaborating, motivating, and goal setting and tracking piece. This is part of, for example, the slide deck. And you will see we have been thinking about mental health since 2014 when we were started the lifestyle medicine education efforts at the Harvard Extension School. We have the medical model on the left, mental health model always called out on the right. Talk about evidence-based approaches in our curriculum. We use the research and the guidelines. We use quotes to keep the students interested, and then practical strategies so that they can dose the medicine of exercise or nutrition or whatever it is, whichever pillar we're in. So I talked a little bit about bachelor's and master's and doctorate level. Lifestyle medicine in medical education has been something I've been working in for a long time. There's an article in Mayo Clinic Proceedings, Innovations, Quality, and Outcomes I'd love to draw your attention to. It was just published in September 2024, and it will give you a lot of information about resources as well. And this is one of the diagrams from it. And I want to mention the importance of behavior change and counseling. The 6 pillars are critical, but motivational interviewing, transtheoretical model change, health coaching, they're central for this LM 101 curriculum. As you notice, there are 2 modules on this topic. In terms of resources, they're laid out here. This is in the paper from Mayo Clinic Proceedings, but I will call your attention to pre-college. We can get this into high schools, get people to embrace these strategies at an early age and keep practicing them through college where they could learn and take courses, or even in medical school where the physicians really need to be proficient in this. Several other resources for you: LMed curriculum, free downloadable, the LMed website. Starting with the Lifestyle Medicine Interest Group is great. We have the LM Question Bank at ACLM that you could use. And then in residency, we do have the LMRC, which you can also use. MGH Psychiatry is looking to adopt this now, and I think using some of it even as we speak. And then the fellowship. Of course, CME is critical, and we do this, and many of you participate in this through the American College of Lifestyle Medicine. With these courses at the Extension School, many MDs have taken them, pre-meds, lawyers, nurses. The beauty of this material is it is interesting and applicable to everyone. It's a full semester course. We've run it by hybrid, so online from different countries as well as in person for years. Multiple states and countries have been involved. I now actually have 4 courses there. It's wellness from the inside out, cell to community, culinary medicine, and empowering people to change is our new one in the spring. Anyone can take these through the extension school. Again, they're in the psychology division. First step is this lifestyle medicine interest group. It is so much fun for me. I was just with them last night for this 2024 crop. This is Alexa Smith. She went into psychiatry actually after being a major leader at Harvard in the lifestyle medicine interest group. It is some of the most fun you could possibly have. You can get funding for this through the Donald A. Peg Award. It's a parallel curriculum. Use the LM 101 curriculum if you want. Lots of fun. If you want to know more about the basics, please do call upon this paper in Clinical Teacher. Now, the interest is soaring for lifestyle medicine interest groups. We are about over half of medical schools now have a lifestyle medicine interest group. We also have other healthcare professional schools that have them in the bachelor's and the master's programs, and health systems are adopting lifestyle medicine interest groups. Do they work? Does one lecture matter? That was the question I had. I wasn't going to keep doing this for decades unless I knew it was actually doing something. And sure enough, we tested pre and post with one of my mentors, who you may well know, Ted Stern, chair of the Department of Psychiatry, very involved in psychiatry at MGH for so many years, a great mentor and person for me to learn from. He helped me with this pilot study where we checked the knowledge of students pre and post the behavior change lectures. Sure enough, we found their knowledge increased. We expect that from medical students from anywhere, right? But their confidence also after 1 hour lecture increased. This is a way to start your lifestyle medicine interest group and get funding. This is Alexa Smith's example of how she used lifestyle medicine in medical school during COVID. So she was one of the COVID medical students. So we were running support groups and lifestyle medicine groups for her cohort by Zoom. So they were actually in their rooms back at home when we were teaching them at Harvard. It's a great story. It's a great article that she shares. I hope you have a chance to look at it. Another stellar lifestyle medicine interest group leaders who are currently physicians, Case and Andre, they helped me put together this lifestyle medicine pocket guide. Sure enough, it fits in your white coat pocket. And medical students, when they're counseling, or residents, or even practicing physicians, when you're counseling patients on lifestyle medicine, you can pull this out. It has graphics you could use right there with the patient. And it also has questions, high yield questions that are motivational interviewing, in alignment with motivational interviewing and compliant, and in health coaching style to get people to talk about these behaviors so you can help them change and adopt and sustain the change starting in the hospital. So here's some of those resources I mentioned to you, the LMED PowerPoints and case studies. You can find them there at lifestylemedicineeducation.org. There's also lifestylemedicinecurriculum.org, whole elective curriculum that you can utilize for your school in medical school or other healthcare professional schools. Many schools now offer electives in LM. They are using the LM 101 and other resources. 2 medical schools we have, you're probably familiar, the USC Greenville with Jennifer Trilk. She has 100 hours integrated for a decade into her curriculum. They started it as a medical school in 2014, have been going strong. Loma Linda also has reached 100 hours, which is incredible. Many of the medical schools have LM tracks now. Students can opt into a track and get more lifestyle medicine education. We adopted a theme approach where we have at the Harvard Medical School the theme of nutrition and lifestyle medicine. So we're working to get nutrition and lifestyle medicine in each of the courses with case studies and with other options. Another way for you to do this about getting lifestyle psychiatry into medical schools is having shadowing experiences with medical students, connecting with course directors in the preclinical years. I know that many of you are already connected in your medical schools. So talking to them about how you could add a case, that would be fantastic. Volunteer to give a lecture on nutrition, on sleep, on social connection. And you know, we have scholarly projects at Harvard Medical School. I think many medical schools have this where the students opt to do a scholarly project in their last year. Many of them have come to me to do scholarly projects in lifestyle medicine. It's a wonderful way to teach and to help the students really understand lifestyle medicine and continue with it after graduation. Participating in the current electives that are available, and maybe you could get your own elective going. They have professional development weeks. I'm sure those are also available in your medical schools. I've been doing them since 2008. They call me in to do a workshop on lifestyle medicine and on stress. I just got feedback. The medical students said to the course directors literally emailed me 2 weeks ago saying, you have to read this feedback you got. This is the first stress resiliency workshop I went to where I felt less stressed when I left. Mostly these stress me out, but please have her come back so we can all feel less stressed. So we know how to do this in lifestyle medicine. Creating a community service opportunity for the medical students, that goes over really well with the administration because they want their students out there doing community service. We partnered Vivian Wang, who wants to be a psychiatrist. She's a second-year medical student now. We partnered with Boys and Girls Clubs here in Boston. We developed and delivered an 8-week course for 13-year-olds that are in a leadership course for the Boys and Girls Clubs in Dorchester and in Southie. And with that pilot going well, we're going to end up doing more of their clubs this summer. Publishing with the medical students is a great idea. It gets them interested in our topics and also involved in the rigor of academics. And then, of course, running a lifestyle medicine journal club, which I have started for the past 2 years to be Harvard wide, bring us all together from our different specialties so we could really connect around what we love in lifestyle medicine. Fortunately, we have Dr. Walter Willett and Frank Hugh and many others who are fabulous and can come and give guest lectures. Teaching the lifestyle medicine residency curriculum has been a joy, and we've done that in Med, and we started it in PM&R, and others are starting it at the Brigham for internal medicine, at Mass General for internal medicine, as well as for pediatrics and, as I mentioned, psychiatry. Starting your own CME, doing your own CME at your own institution could help. This is an example of the laughter prescription I did with the president of the Lifestyle Medicine Interest Group. Oh, back in, I feel like it was 2017. And then a pre-med who was involved with our lifestyle medicine interest group who is at Harvard. They're, of course, physicians now and practicing. This is what I want to call your attention to. Earlier, I mentioned these proposed nutrition competencies for medical students and physician trainees. You'll see that many of them are in your wheelhouse with expressing empathy, with using culturally sensitive language, and using motivational interviewing. And then, of course, the competencies around nutrition knowledge. Here's just the overall general slide on the LMRC. Please go to the website to learn more, but it's 40 hours of didactic material and 60 hours of application activities. They have so much fun. These are the Med residents. They have come back time and time again. It is now my 3rd year doing it. One of them took the exam just, I think, 3 days ago, and he's hopeful that he passed. We'll see. And these are the other ones, the residencies that are involved. When you do the LMRC, you can also invite people. I'd be happy to Zoom into your group. I had David Katz Zoom into mine. And then we actually reviewed what the Med residents felt about the curriculum and how they were experiencing the LMRC and the lectures that we were giving. And 100% of them said that they valued them, that they wanted them next year, that they felt they were helping them clinically. It was really an incredible survey result, and we published that. This is just sharing with you the timeline I already told you about at Harvard. We had our first LMIG in 2008. We actually started the Harvard Extension School course in 2014. This is when LMed started and Jennifer Trilk started at USC. LMed theme started in 2017 at Harvard and board certification. And then we had our first elective in 2019 at Harvard in lifestyle medicine nutrition, started our journal club in 2022. We got a culinary medicine elective approved after 3 years. And that was in 2023. We're very excited about that. Those of you that are not in medical school, there's a whole academic pathway for healthcare professionals. CME, CE, I'd love to just share with you the multitude of resources we have at ACLM and hope that you can dive into those. This is a free essentials course bundle. You likely know about it. Please share it with others that are interested in lifestyle medicine. This is another free course that you can take today. We did this with the Department of Surgery at MGH and Spalding Rehab Hospital. It's 6 hours of CME, and it is at your own pace, and it has all of the pillars of lifestyle medicine. It does count for maintenance of certification for those of you who are already certified. Now, in terms of education, educating through YouTube, this is something Harvard tried. They had me as one of their pilot faculty to give some mini lectures on clinician well-being, and they have several now on cardiovascular health and pulmonary health and other topics. This is something that your group may want to consider too, using YouTube. Um, and I do love the idea of the journal club. I love the idea of wellness rounds. We've been doing this at Spalding Rehab Hospital, giving lifestyle topic lectures for grand rounds. We're calling it wellness rounds, but it's 4 grand rounds. They get CME. It's the same time as regular ground rounds. It happens 6 times in the year. If you'd like to join us, you are welcome. I did get the okay to invite others to our journal club, which is happening on Thursday with Frank Hugh. The topic is his research on heme iron and the risk for type 2 diabetes. Another thing that has happened with lifestyle medicine, and when you start educating like this, guess what? Well, it goes back to my original research as a resident in 2000. Physicians want this for themselves. So the Center for Faculty Development there at Mass General, they call me in as faculty to coach the other faculty. So for 3 years, I just had a coaching session with surgeons from Brigham and Mass General last night. It was our 6th of 6 sessions. I coached them in the pillars of lifestyle medicine for 6 weeks. It's a joy, a pleasure, and a true honor. And guess what happens? They get board certified. True story. They'll come in to get healthy, feel better, and then they get really interested in lifestyle medicine, and they get board certified. It's fascinating and fun. Lastly, there's mentoring programs. The Department of Surgery called me in 2018. I've been with them now for several years, and they brought me into their mentoring programs because they wanted to make sure that their surgeons, young surgeons, were doing well, feeling well, had an enhanced sense of well-being, and weren't burned out. So this is for early. Oh, just finished. Yeah, sorry. Do you want me to end? Oh, I thought I heard something. I'm
No, no,
almost done.
that wasn't me. That was somebody just joined
Oh,
the
sorry.
call. Yeah,
Sorry. Oh,
yeah.
so close to finish.
Yeah, no, no, that wasn't me. Go ahead.
Okay, so we have early career mentees, and then there's a faculty member that talks about surgery and their techniques in surgery, a faculty member that talks about research and how they need to do research and get their grants. Another faculty member talks about promotion and getting involved nationally and internationally. And then I just was in one of these at 7 a.m. on Monday. They always have them at 7 a.m. at surgery. And I love it when they say, "Well, wait, we have Dr. Frates, so let's stop. Dr. Frates, you go ahead and now you talk about well-being." So then I talk to these early career surgeons about their own lifestyles. We call it well-being, but I go through all the pillars with them. And the faculty start asking questions about themselves during the mentees program. Anyway, it's been going on now for 3 years. We wrote it up here in the American Journal of Lifestyle Medicine, and I hope that others will carry it forward. And this is just my last slide showing how much progress we've made at the American College of Lifestyle Medicine in terms of the enrollees in our essentials course, our lifestyle medicine interest groups, our residency curriculum numbers, our health system council numbers, our active members. We're actually up to 13,000 now, and then those that are certified. Many just sat for our fall 2024, so that number will go up significantly. And you guys are the future of lifestyle medicine in a significant way with lifestyle psychiatry. I hope that some of what I shared was helpful to you, informational, and maybe you will use it in your own journeys with lifestyle psychiatry.
Wow. Wow. Thank you. So what a wonderful, quick 360 view of everything you've done in the field. Thank you so much.